All digestion of food starts in the mouth where it is chewed and mixed with saliva. Enzymes in the saliva begin breaking down carbohydrates like bread into simple sugars for your body to use. After traveling down the esophagus, the remaining food lands in our stomach and intestines, where digestion continues with the help of enzymes from the pancreas. The beta cells of the pancreas sense the rise in blood sugar, causing them to release the hormone insulin. Insulin signals the body's cells to let sugar inside and remove it from the blood. Insulin travels to the bloodstream, where sugars, also known as glucose, are waiting. Insulin signals the body's cells to make receptors for binding to glucose. This allows both insulin and glucose to separately gain entry into places like the liver, so that our body has the fuel it needs to function. In the liver, glucose is either converted to energy or stored for future use, and blood sugar levels return to normal. When a person has type 1 diabetes eats food, the body acts differently. Once food lands in the digestive tract, the pancreas signals its beta cells to digest sugars, releasing a small amount of insulin, or none at all. That's because in type 1 diabetes, antibodies target the beta cells of the pancreas, destroying them. As a result, the glucose in the bloodstream outnumber the amount of insulin available, causing blood sugar to stay high. The insulin allows some receptors to be made, allowing some glucose to enter the liver, but the rest of the glucose stays behind in the blood. This prevents glucose from being converted to energy or stored. So the body resorts to making energy from muscle and from fat tissue, decreasing the amount of fat the body has to support it. This causes a buildup of acids in the blood that without treatment will lead to the serious complication of diabetic ketoacidosis. With type 1 diabetes, you can still eat out, but like with all meals, you have to think about carbohydrates, which break down into sugars. Each food has a certain number of carbohydrates. Checking your blood sugar to see how high it is and then giving yourself units of insulin based on that number keeps your blood sugar in check. After pricking yourself with a sterile lancet and putting the blood on a test strip, the blood glucose meter will give you a reading. The insulin to carb ratio will also help you determine how much rapid-acting insulin to take with your meal. You can adjust your insulin pen to add the right amount in addition to the 24-hour insulin dose that you take daily to cover your basic metabolic needs. The injection of insulin goes into the bloodstream just like the insulin your body normally makes without diabetes. There, the injected insulin allows the blood sugar to enter the cells and to be converted into energy that the body can use. One thing this energy can be used for is exercising, the same as in people who do not have diabetes. But in diabetes, the difference is that before a run, you must check your blood sugar to make sure it is not too high or too low. Once on the run, if you ever experience symptoms of low blood sugar like dizziness or a fast heart rate, you need to stop. Sitting down to rest while eating glucose tablets and drinking juice will quickly raise your blood sugar, helping it to get back towards a level that is within range. And you can keep enjoying your run.